While medications and medical technology have enormous potential to make people better, they also have the potential to injure, and in fact injure tens of thousands of people each year due to side effects or being used the wrong way.
When we look at why patients are harmed from medical errors, medical mistakes, in over 90% of them I found somebody knew something was wrong but either didn't speak up or spoke up and was ignored. Now that is a profound cost for a poor culture. In aviation, they learned this lesson the hard way. They found that the voice cockpit recorders of several crashes had a co-pilot speaking to a scared pilot that was just ignored. And what they found was that they had a very hierarchical culture, and so the pilots filtered what co-pilots had to say. And their response was training and teamwork and improving their culture that respects the team, values everyone. Healthcare could learn an awful lot from that. We still have a very hierarchical culture. We don't tap into the wisdom of that frontline doctor or nurse who's been there for years, who knows what the problems are. We have often safety solutions that come top down from external managers or regulators. And healthcare would be wise to focus on teamwork and really tapping into that wisdom of frontline staff. And I say to them, well, let me ask you a simple question. In your hospital, if a junior nurse were to see a senior doctor not comply with the checklist, would that nurse speak up and would that interaction go well? I say to them, well, let me ask you a simple question. In your hospital, if a junior nurse were to see a senior doctor not comply with the checklist, would that nurse speak up and would that interaction go well? And unanimously, Norm, they say, are you nuts? There's no way that nurse would speak up, or if she did or he did, they would get yelled at. It would never go right. You know, and I hear that and I pause and say, what other industry would tolerate the wanton violation of a standard that kills in the US 31,000 people a year? To frame that, Norman, that's almost as many people as die of breast cancer every day in the US. But unlike breast cancer, we have the cure. The hospitals have the cure. And we need to learn, not just recover from our mistakes. So healthcare clinicians are fabulous at recovering from mistakes. The supply is not there, so the nurse runs and gets it. Or I overdose and I resuscitate the patient. What we're terrible at is stepping back and saying, what am I going to do to prevent this from another patient? I can't imagine another industry where there's that little accountability.
So what do you do to change it?
The way medicine is organized, there's really strong individual physician accountability for their patients. Like, I know many physicians in Australia and in the US, and they care deeply about what happens to their individual patients or for their little slice of what they do. My gallbladder surgery goes well. The problem is they're system myopic. We don't care just about what you do for your patients. We want to know all the patients at your hospital or all the patients with this disease or in this region. And there's no infrastructure to manage that. We've been asking doctors to do it on their back, but we don't have good data systems. We don't have an infrastructure. So we're going to have to invest in an infrastructure to hold it accountable.
Surely there's a role for consumers to actually force the game here. In the United States, you have litigation, but that only has limited effect.
Yeah, so absolutely. I think consumers have an enormous role to play. We've seen time and time and again that consumers have a vital role in creating an urgency and shedding a light on substandard performance.
Information on how to make a report will be on our website, as well as pointers to know whether or not some action has actually been taken.